Welcome to Culture Focus. Today's special guest is Dr. Brandy Brown from Extraordinary Family Healthcare. Her practice is in Georgia, but she is here in New York helping to treat patients during the pandemic. So she offers a very unique perspective for our audience and Culture Focus fans. So we certainly wanted to touch base with her and get her perspective, and also discuss the challenges of certainly practitioners and clinicians, frontline workers during this time, and how they're coping during the pandemic and treating patients, as well as what made Dr. Brandy come to New York as well and leave her home during this difficult time. So let's dive in with this Culture Focus Voice of Hope. Dr. Brandy, thank you for joining us today.
Thank you for having me.
Oh, you're welcome. You're welcome. As I alluded to in the opening, your practice is in Georgia, and you came to New York. So what made you want to put yourself at risk and come to New York? I certainly appreciate you doing that. But tell us a little bit more, please.
Ultimately, it was just kind of like a random thing. I was actually already in California working for a week for another position that I do as needed. And when I heard about it, that is when actually even California had started shutting down at that point. Okay. So, yeah. So it wasn't a whole lot going on there. And I was heading back to Atlanta as well. So when I happened to hear about the need here and was asked by an agency to come out and participate, I decided why not. I mean, this is what I'm this is what I'm built for. This is what I went to school for. This is what, I'm educating other nurse practitioners that are coming behind me, other nurses. I'm telling them, this is what our job is set for. We're here to help other people, Mm-hmm. So that's what kind of made me come. Plus, being that I took myself and put myself in the military at one point, that is, that's just the culture, a humanitarian, our goal in these professions is to help other people. So yeah, it means sometimes we have to risk ourselves, and that's just part of being in a helping profession. I don't care what profession it might be. You have to be open to being able to be available for some of the most outrageous things you could possibly think of at the time, but people need you. And if you're able-bodied and you know that you can help somebody, I don't see why you wouldn't.
Yes, understood. And for the viewers, can you repeat, how long do you think you will be in New York?
My plan is hopefully to be here just another 2 to 3 weeks at the most. It is dying down quite a bit here. I've been here a little over a month now.
Oh, wow.
Yeah. But things are starting to get better. The admissions are definitely down. The COVID numbers are definitely down. So that's a great thing. So primarily I think New York is going to be more in recovery position come June and trying to get things back on track.
That's good to hear.
Yes.
And then hopefully the rest of the country follows suit, so to speak.
Sure. We're hoping, but I don't see a lot of governors and mayors being too smart. You only have a few here that are kind of like really thinking through the process, and some are just kind of worried about the economy.
Mm-hmm. Mm-hmm. True. Putting the dollar before the health of the society as a whole.
Correct.
Tell us, which is unfortunate, of course, which is why I wanted to do this series, to get the message out to the public, and it's particularly not only the general public, but also within the African American community as well, and other minority communities that seem to be disproportionately impacted. So since you're here, you're at one hospital, can you tell us, or are you floating? How did the agency arrange things for you?
It really is varying based on hospital needs. I did go to another facility for a little bit, and then I was kind of displaced for a second, and then now I'm back at another hospital. So not really sure if I'm going to be there extended or not, or if they're going to need me somewhere else. But, you know, the situation, of course, has been fluid this whole time. So it's really just being available and I'm willing to, you know, go where the need is. So, you know, most people are at the same place most of the time, but, you know, every so often some people need to float other places because the need gets greater somewhere else than where they may be at.
Yes, flexibility, key.
Yes.
And you are seeing only the COVID patients then while you're here, or?
Well, actually, it's kind of that's our goal, but really you can't distinguish 100% COVID over non-COVID because some people are coming in and they may not be there for COVID, but somehow they've contracted it in the process of being there. So there's a possibility that person may be tested and come to find out that they have it. So that may not have been their original rationale as to why they were there.
But based upon their symptoms that they're experiencing, they get tested and diagnosed. Okay, so
correct.
Then were you also, you said you were in California, were you seeing COVID patients in Georgia, or it kind of hit while you were already out in California?
It hit more. It hit more deeply once I was out in California.
Even okay. So you didn't necessarily see any in your practice, because I was going to see if there was a difference between the patient population that you were seeing. But then, since you're in California as well, do you have any nuances that you saw between the different patient populations?
I mean, I've had people come to, I mean, I'm still accessible even through telemed and, you know, just in general of other people that I know in general that will call me if there's something comes up. And I've had several people that have been COVID positive that contacted me and let me know what was going on with them and asked my advice as far as what to do and what they needed to do. So, whether I'm in California, Georgia, here, I still deal with people regardless that have it. And in California, I usually work with the Border Patrol there when I'm with another agency, and we were actually lower once everything, as far as seeing people coming across the border once everything hit with COVID. So it was funny because the Mexican government had decided that, you know, they were shutting down the border, and I was like, really? So they were putting in a little extra effort, you know, and not letting people over. Yeah, so we were still screening people, and we had a few people we, you know, had that came through that we thought might, but it was still a lot of flu and other stuff that was coming across the border at the time before they shut all the way down. And as far as Georgia is concerned, I've had patients from Georgia that have contacted me in regards to this, and I think there's probably only one that I know of for sure that was actually hospitalized, but they already had some other things that had went on within the months prior to. So kind of was expected for it to happen that way.
Okay. So it sounds like you travel quite a bit, perhaps, and enjoy.
Well, recently, within the last probably 6 months to a year, I have started traveling a lot more, you know, as far as working.
Wonderful. That's wonderful, though. You know, get to see
Yeah.
more of the country, etc., and, you know, different perspective on things. And while, you know, from your different rotations, it sounds like you have telehealth you mentioned, so that's wonderful to allow people basically throughout the country then to access you. Am I
Yes, definitely.
correctly? Perfect. So that's good for viewers to know. And then the treatment here in New York. How are patients doing? Let's focus in on New York. And the treatment that, you know, there's been all this hype around chloroquine and drugs of such as this. There's a race in the antiviral as well as other medications that may be able to treat COVID. So tell us from your experience here in the New York hospitals, what are you guys using?
there are still providers that are utilizing those antivirals, and they're kind of doing more of trial runs with those. So I can't really say that that's 100% where that goes, because they're really not the same virus, you know. So I think that their goal is to try to figure out if they can utilize this for a different virus, but I haven't seen, or I can honestly say that people are recovering from it, because ultimately some people were going to recover anyway. Truth be told, viruses aren't really made for curing, if that makes sense. The antivirals that we tend to come up with are really to reduce symptoms, or to reduce the time someone is actually sick. It doesn't necessarily cure somebody, if that makes sense. So that's really the goal, that some of the that's what the goal is with the antivirals that we're are trying to utilize. However, you know, what I've come to see and what I know to be true, this is a respiratory virus, you know. So with that being said, we need to treat it as a respiratory virus. So treating people from the beginning when they first start having symptoms, giving people the knowledge of what it is that they should be doing, and treating these symptoms as we would if they were to walk into our clinic and have a conversation about the flu or an upper respiratory infection or a sinus infection. Giving them those same list of things to do would really help a lot of people initially. But the thing is that that's not being done. Some of those things aren't even being done in the hospital. You know, just some of the most basic things need to be done, and it will reduce the symptoms.
Oh, like what? Like what?
Something as simple as just being hydrated. Something as simple as continuously taking Tylenol for maybe, you know, 24, 48, 72 hours, whatever the case may be, to help keep the fever down.
Okay.
Of course, we want you to have a fever to an extent, because that's the body's way of fighting, you know. Something as simple as drinking hot fluids, or using a humidifier, or using an expectorant like Mucinex or Guaifenesin over the counter, just to help reduce the actual mucus that's built up. These are all things that our body does defensively to help protect us overall when something is there that's not supposed to be there. It will overproduce, of course, and cause worse symptoms and make you feel even worse, and maybe even cause other problems if that virus is not able to be helped or stopped, or however you want to. I'm not really how to put that, but basically, that's the body's defense mechanism. So yes, the virus can still get in and start trying to mess with the way your body is functioning and messing with organs and so forth. However, if we're starting to treat these symptoms ahead of time, we can probably keep some of that virus at bay and reduce it, because it's almost like an overload of the system, if that makes sense. So your body's like overdoing everything to the point where it might even, you know, it's done so much that it's probably pushing your body too much, to where, you know, how computers like trying to keep doing something too much, and it's revving up, and it's like, then it just kind of poops out on you. Kind of how your body does sometimes when it's trying to overdo something because it's trying to protect it so aggressively.
Yes.
So prevention is really key here. It's really the biggest thing.
That's great information, especially those at home, those that are caring for family members. So what the knowledge you just imparted upon us was great. Thank you so much for that. And then when going to the hospital, then what can patients expect then?
When they go to the hospital now?
Yes. What are you seeing?
The expectation is still they're going to, you know, of course, check you for COVID. They will most likely do the antibody testing. I think that's going to be the standard moving forward, outside of the nasal swab thing that we were doing, because ultimately that antibody test is, I think I told them on CNN, you know, I think the patients have to understand the rationale and the value in these things, so that they can understand how it's going to benefit them in the long run. But that particular antibody test lets us know if your body has made antibodies, and or if you're currently infected and you may produce antibodies after the fact, you know. So I think that will be the standard moving forward in trying to figure out who has what, you know, how long those antibodies may last in your body. There's a assumption that your antibodies it wouldn't be a lifetime thing. It would be something that would be for a short period. So that I'm not 100% of an expert on. I can't really say if that would be true or not true.
Let me ask it differently.
That's kind of the process. Yeah. And then, of course, going back to doing treatments. If you go into the ER, depending on what your actual symptoms are, they're going to try to treat you and tell you quarantine and so forth without having to admit you.
Okay.
But of course, if you're really to the point where you're decompensating in some way, where your heart's not working the same, your lungs are not working the same, expect to be, admitted to the hospital and there and being treated, based on the protocols that they have in place. And again, hospital is a little bit different as far as how they're treated.
So
there's no standard protocol across the board right now.
Okay. But some of them would be with the fluids, Tylenol, oxygen, those types of.
Yeah, most of them will give you most of those things. I think one of the things that has come up that I've noticed, I've found out, and I have talked to other providers that are here as well. I've noticed that due to the recommendation of decreasing the amount of fluids that we give patients during this time, because they're worried about an overload of fluid in the body for some rationale.
Makes sense.
That's not being done as well as we would like it to be, and it's causing pressure on the kidneys. So you end up having a backlash on that. You know what I'm saying? So if you're already having very chronic, you're having chronic illnesses, or you're already not don't have good kidney function or good heart function or a good immune system or whatever the case may be, you're going to suffer the worst case scenario versus the better case scenario of the COVID scenario.
Yes.
If that makes sense. And it doesn't matter who you are. I don't care what color you are. I don't care what sex you are, for anybody. So if you're not taking care of yourself, before this,
yes.
you can expect a harder comeback now. You know what I'm saying? Unfortunately, especially if you wait too long to get seen.
Comorbidity.
So that's not the outcome.
Yes.
Unfortunately for many.
Yes.
But some people I know have heart disease, have had strokes, have had all kind of stuff, but they're okay after this COVID scenario. They were able to kick it.
Okay.
So I think it really depends on the individual.
Okay. Yes, because we hear a lot in the news about death rates going up. And so I wanted you to speak on, since this is Voices of Hope, the recovery as well, and what we're seeing. Because certainly, we want and we hear that many recover and go on to do just fine.
Right.
And so certainly some of that may be due to not only the physicality and, within their own body ability to recover, but then also their mental health and wellness and emotional well-being, which we'll touch on here in a second. But before we leave this section, I wanted to talk a little bit about how best family members can support their loved ones during this difficult time. What are your thoughts, since you do telemedicine as well and travel around the country? Any feedback
It's
there?
a family thing. It's a family thing. Like I tell people that are trying to lose weight, everyone in the house has to participate in, recovery as a whole. So if one person is not feeling well and they're trying to quarantine and be away, then it's expected that the rest of the family, stay away as well. But, keep up, good hygiene, keep up, washing our hands and so forth, as a family, as a whole, husband, wife, kids, whoever it might be. It's a family thing, and still be able to check in with that person, still call them, text them, wherever they might be. A lot of people are being very isolated. So just besides everyone just being stuck in the house, but those that have to actually be isolated into another area in their home or even another place, it's important to talk to them and reach out to them and make sure they're okay.
Mhm.
because mental health, as you stated earlier, is very important. That is what emotional and mental health is what actually keeps us healthy.
Yeah.
You're very negative and you're, alone, sad, depressed, whatever, the rest of your body is going to decompensate to go along with it. So we need to definitely make sure that we're supporting each other mentally and emotionally during this time, no matter, what the situation is. And I know that many of people are scared
Yeah.
based on what, they've been hearing in media and what people are telling them, instead of really giving them hope and really letting them know that there's way more people that go on to be just fine than it is people just, dropping like flies. That's how they're making it seem. It's like as soon
Yeah.
as you get it, you're gonna drop on the street.
Right.
And then it's not the case at all.
Yes.
So we have to not be so scared, but more cautious and
Mhm.
very
Proactive.
supportive of everyone,
Mhm.
whether they have it or don't have it. Don't treat everybody like they're a plague.
Mhm.
Treat
Mhm.
them like they need some assistance, they need some help,
Mhm.
because you never know if that's the last time you're going to see somebody or talk to somebody
Yeah.
or whatever the case may be. So I think we need to be a little more on the humanitarian side when we're dealing not just with our family, but with people around us as a whole.
Yes, understanding. And you touched on mental health. And so I want to talk a little bit about nurses and their mental health. And first of all, how are you coping yourself, being away from family and away
Um,
from...
I'm doing okay. I mean, I'm a very spiritual person.
Okay.
So, I think very spiritually. I do a lot of, self preservation. I take time to myself, and I do check in with people. People check in with me every day. I have somebody that texts or call me. Anybody, just somebody
Yes.
checks in on me. So I appreciate that wholeheartedly. I didn't know I was loved so much.
Oh, that's that.
And I've made a lot of, met a lot of new colleagues here too. So when we're all able to get off or have time to, hang out or something, we will take the time out to, just talk. Try not to talk about COVID and work too much.
Yes. Yes.
But
Exactly.
we try to do some camaraderie, type of things. But there are a lot of nurses here that are going through it mentally. Some are drained in more ways than one for various reasons. And so they have either gone home or they've always offered us mental health days that we can take
Okay.
when needed. We have counselors here that are available to talk to us if we want to talk to somebody here on site for whatever reason.
So the group of you, the agency put you in a hotel with others, so you're not isolated. Then is the sense that I get?
No.
No.
No, no, we're not isolated. There's plenty of, nurses, nurse practitioners, there's PAs, there's some respiratory therapists.
Mm-hmm.
Of course, there's people from the actual agency that are here.
Yeah.
So, there's people around us that we can, that are going through the same things we're going through. So it definitely, we can talk to each other.
Okay.
And again, they've sent counselors, crisis counselors down for those that, mentally not able to handle this
Yes.
the way they need to, so that it's something that's available.
Yeah.
So it's been awesome, actually.
That's good to hear. Because is there anything in particular that you wish you would have known going into this? Now looking back, like in the thick of things, because you're still here and you will be for you said another 2 weeks or 3 weeks or so. So is there anything that you wish you would have known now looking back on things?
No, not necessarily. Not off the top of my head. I think I'm totally okay. I mean, again, again, just my background and what I do and what I'm set. My mindset is I already knew it wasn't going to be like a normal hospital contract or, just
Yeah.
going somewhere. I knew that it was going to be a lot going on. I knew things were going to change moment by moment.
Mm-hmm.
I knew military were going to be here. So just having that, that background already, that training, that being in that type of environment already, it's kind of like, okay, I'm ready for whatever happens. And I think that, moving forward. And I think I put this out on my pages and on my Facebook page and in my nursing groups and so forth, that disaster training is needed for nursing as a whole. And I don't think a lot of nurses have that. So this kind of put a toll on many people, especially mentally. They didn't expect to see so many deaths. They didn't expect to be in predicaments where they may not have been exactly in their element. You know, they had to kind of just adjust to what was going on around them.
Exactly.
So I think that once that becomes more of a normal for most of the nurses, no matter where they are in their career or where they work, I think that if anything like this was to happen in the future, we would even be more prepared as a whole, because that type of training only comes if you are a part of different things. You know, it's not something that's just a regular type of in service that most people do.
Yes.
So,
yes.
Yeah.
And one of the things I wanted to share with you, because there was a article in March published by the Journal of American Medical Association, JAMA, and it spoke about factors associated with mental health outcomes among healthcare workers exposed to COVID in China, actually. And so one of the questions that they asked were, what are factors associated with mental health outcomes among healthcare workers in China who are experiencing or treating patients with COVID? And so some of their findings were, because it was a cross-sectional study of 1,257 healthcare workers from January 29th to February of this year, across 34 hospitals, actually, that were equipped with fever clinics and wards for patients with COVID in multiple regions of China. And so a considerable portion of the healthcare workers reported symptoms of depression, anxiety, as you touched on, insomnia, distress, especially women, nurses, those in Wuhan at the epicenter, and those frontline healthcare workers directly engaged in diagnosing, treating, or providing nursing care to patients with suspected COVID. And so the findings suggest that among Chinese healthcare workers exposed to COVID-19, women, nurses, those in Wuhan epicenter, and those on the front lines, they have a risk of developing unfavorable mental health outcomes and may need psychological support and intervention, as you alluded to. Because in actuality, depression, 50% of them experience depression. Anxiety, 45%. Insomnia, 34%. And then as far as psychological distress, it was at 71.5% of them. So as you were speaking to the mental health challenges and the depression and certain emotional strain that's on the healthcare workers, I think it's very important that the public knows that, and as well as it was good to hear that there is some support for your group that is here, but certainly going forward for those that may be treating this patient population, as you spoke to, there needs to be some type of a master training or maybe a better understanding of what to expect before they get there, is what I'm hearing you correctly.
Yes. I mean, it's just like, it's different, but it's the same. You know, when you're going somewhere where there was a hurricane or there was a tornado or, you know, things of that nature, because I mean, ultimately there's going to be destruction all around you. But being able to not take it into your heart personally, you know, to make it not be so not weigh you down so much, being able to somehow I want to say separate yourself from what your job is versus, you know, how you kind of feel at the time. It's very hard because I mean, we're human, you know, but it's so important to try to do that in these types of situations, because that's how you survive. That's how you make it through. That's how you know you're going to make it home. And if you're going to break down later, you're going to break down later. It's going to happen.
Yeah.
But just being able to try and separate yourself during that time and trying to focus and just be ready to go so you can help as many people as you can is important. I mean, there was a lot of people that went home within the first, week or two of being here because it was just too much for them. It really was.
Mm-hmm.
And they complained and they were upset. And, for me, I get it.
Mm-hmm.
But this is the job you signed up for.
Yeah.
So, it's almost like I look at it on both ends of the spectrum,
Mm-hmm.
the police and the firefighters and the first responders deal with this all day long, every day. And if they decided that this was too much and they just didn't show up for work anymore, what would happen?
Yeah.
What would happen to us? So I feel like this is what we signed up for. We're part of that same, scope of people
Yes.
that show up for these type of events, and we need to be ready for them. We need to have our mental health as close to normal as we can get it. We have mental health issues throughout the healthcare field, no matter what, not even just during COVID, but just regularly. So this just added on, 20 to 30 times more of whatever someone was already feeling at the time.
Mm-hmm.
For me, it was more of a pep in my step, you know what I'm saying? It uplifted me more so because I felt like, okay, now I'm really even getting to add more to what I've been training for, what I've been practicing doing. This is my time to actually shine and go utilize all this stuff I know and put it in place. So it really, all of this just affects everybody very differently.
Yes. Yeah.
But there are many mental health care professionals that I know that are out there. I know a lot of them. A lot of them are letting me know that they have a lot of free services they're offering healthcare professionals. There's a lot of people just willing to come together and try to help as much as possible that are after this, because yes, the healthcare professionals' health even after this, is just as important as during it. So I'm hoping, that we don't lose anybody in this, people willing to still, continue to be where they are professionally and don't just run away, because we're going to need people moving forward. But hopefully they will at least take advantage of a lot of these mental health opportunities and make it seem like, oh, well, I'm nothing wrong with me, kind of thought process.
That reach out when they feel themselves in need of speaking to someone, or reach out to local resources in their communities, or certainly a fellow nurse practitioner, perhaps, such as yourself, that have been in the trenches and know what to expect. Certainly. Yes,
we want people to just, accept, we try to tell patients that don't put a stigma on yourself because you're depressed or because you have anxiety or whatever. We want people to feel like, you're still a normal person, we all go through it. So I'm hoping that other healthcare professionals, I don't care if you're a doctor, nurse, respiratory therapist, CNA, whatever you are, nurse practitioner, I just want you to take care of yourself physically and mentally, because mentally is so important, because you can't support another patient, you can't teach another patient, you can't help another person, let alone your family, if you're not mentally or emotionally stable. So, don't look at it even for yourself like things wrong with me. Look at it like I need to just make sure I'm okay, because I can't do anything for anyone else without it.
Right.
So that we can all just hopefully at some point in time, get back to being able to function in a normal capacity here in the United States.
Yes, yes. Well, you've touched on your passion for helping and your background some. Tell us about your practice when you go back home back in the trenches. I understand you have a spa, and it's a nurse practitioner-owned clinic. So tell the viewers a little bit about it.
It's a new practice. I started about 2.5 years ago now. It is a family practice. I'm still very new at, gaining my patients and everything, but it was important for me to have a med spa and a family practice kind of combined, because I'm very holistic. So I want to be able to take care of people from the inside out. Yes. So I focus on the mental, the emotional, the spiritual, the physical when I'm dealing with my patients. I don't minimize any part of that. It's all combined. So even when I have patients that come into me for weight loss, my first question is, are you mentally prepared? Are you mentally ready?
Yes.
Kind of thing.
Mm-hmm.
So I have a nice little office that I've put together, and I have several patients that I have that come see me. Most of them actually are healthy, or I've made them too healthy, so I don't see them as frequently as I would like to.
Congratulations on the new practice. That's fantastic. That's certainly fantastic. So,
Well, it doesn't keep the money in the practice. So I definitely am looking forward to helping more people. I do a lot of outside work as well. I do travel to other clinics and other offices to help out with patients as well when there's providers out or they need additional help.
mm-hmm.
And I also do veteran exams there at my office to help with my former colleagues and soldiers and so forth to help them get their benefits.
And what made you want to open your own practice for those nurse practitioner students that may be coming up behind you?
For me, it's freedom. I mean, Georgia is still a very restrictive state, don't get me wrong. So,
mm-hmm.
Having to get in contact with the right colleagues and the right, physicians and so forth that I deal with, is important for me. Yep. But I just feel like it's freedom for me. I'm able to express my healthcare practice the way I want to. Yeah. So like I said, I'm very holistic in how I approach things. I do things that other people do, things that people probably wouldn't even think about doing in a normal medical practice. So for me, it's just freedom to be able to explore and do other things that are different from other practitioners, but also to provide the best possible care I can, mm-hmm. and not under anybody's thumb, yes. per se. Right? Yes. I like to be able to cater, if you want to call it that, or mm-hmm. make it, formulated for each individual, yes. or each family, or whatever the case may be. Mm-hmm. I want it to be that way because nobody is 100% the same. Yeah. I don't care if I'm related to you. Your body and how you function and your emotional state and all that is going to be very different than mine. So I just want to be able to provide that for my patients.
Well, you certainly are a role model for nurses coming up the trenches, so to speak, of where they can take their practice long term. As we wrap up, any final words of encouragement for the viewers and for the public as a whole, based upon your experience here and throughout the country, treating patients, or anything that you would like the viewers to know overall?
That it's going to get better, mm-hmm. and that it's going to take a team effort, and that means everybody as a whole, mm-hmm. To be conscientious, not scared.
Yeah.
To understand, to ask questions, ask people questions, ask healthcare providers questions, when you're not sure about things, especially when it comes to this. Ask questions, because I noticed, a lot of media and all the CNNs and Fox Newses and so forth, just news in general, people are really talking over people's heads and not really focusing on educating them and making them understand rationales as to why we're doing certain things, why things are important, or even making them understand why are we, doing this particular study, or what study does this mean? What does this mean overall for people? Getting people to understand those things. So I say just stay up on things, stay focused. Don't watch news all day and night. Mm-hmm. Enjoy your life, just be conscious of what you're doing. Things that many people haven't done before now. Now everybody's conscious. Now everybody's like, oh, I need to wash my hands 100 times. Oh, I need to have this and I need to have that, things we should have been doing from the beginning, so you wouldn't be in such a frantic state at this point.
Yes.
So if you just make it your regular routine, you'll be okay. You'll definitely be okay. I promise. It's just a matter of, everybody, even businesses, I love how cleanly all of them are. And I'm like, hey, this should have been the motto from the beginning.
Exactly. Well, thank you. Thank you for
Yes.
being a voice of hope, certainly during this difficult time, and providing some knowledge and sharing your lessons learned throughout the country. So we certainly appreciate you bringing this information to our viewers and taking the time out of your very busy schedule. And certainly New Yorkers appreciate your help during this time. So again, good luck over the next few weeks while you're still in New York, and certainly safe travels getting back home. And good luck with your new practice as you continue to build your patients, and certainly take good care of yourself, and many blessings to you and your family.
Thank you so very much. Thank you for having me.
Mhm.
And definitely want to say thank you to New York. They have been so good to us. They have treated us very well since we've been here. I couldn't say I couldn't say thank you enough. They've been very gracious to us while we've been here. So thank you, everybody.
Fantastic, fantastic. You take care.
You too. Thank you.
Bye-bye.
Bye bye.